Hey, what's up everybody? Chris here. I'm the CEO of a startup company focused on ensuring there's a sustainable supply of human plasma and other components necessary to treat and cure the rare and chronic diseases that rely on plasma-derived therapies. I'm also the host of this podcast. Did you know there are more than 1 million plasma donors and more than 100,000 dedicated staff and professionals supporting this industry? But no one is having real conversations focused on the issues that exist within the current system. We sit down with people from all walks of life to have real conversations about all things plasma so that we can all learn the human side of this incredible business. Okay, so today we have with us Megan and Ryan. Megan, thanks for taking the time to speak with us today.
Hey, Chris, it's great being a part of your podcast and getting to learn more about your organization and share a little bit about my experiences.
All right. Well, so I love your LinkedIn tagline, which is sharing an authentic patient voice and lived experience as a primary immunodeficiency disease advocate and community volunteer.
That's me. So I have learned a lot living as a patient with a primary immune deficiency and have taken what I have learned to be a better advocate for our patient community, as well as volunteering in the community, both in the PI community and in my broader community.
That's great. I think the more we can do to engage the donor and let them know that what they do is really valuable and it goes to somebody, you know, it's not just this nebulous thing that ends up in the, you know, in the interweb somewhere. I think that is something that's great. And I think it will create more of an engagement from the donor community. So thank you for being that voice. I want to introduce you just a little bit, and then
Sure.
we have a whole bunch of questions to ask you about your experience as a patient. So you're a Texas A&M graduate. You worked for one of the big four professional services firms, as particularly in the utilities and mining sector. You were a patient, which we already talked about. You're a patient advocate. You were the board treasurer for the Jose Antonio Grifols Lucas Foundation, which those of us who worked for Grifols know what that means. And you've also been doing some advocacy work for a nonprofit called Undies for Everyone. Tell me more about that.
Yeah, it's a great organization. It was founded in Houston by Rabbi Amy Weiss. And I met her about 8 years ago when she was a pretty much one-woman show that was meeting that unmet need for children in the Houston area. So many people don't want to talk about underwear in the clothing life cycle because underwear is just a little bit of taboo. And when you think about buying clothing or school supplies or back to school gear for kids in need, most people don't think about the basic and most essential need kids have. And school nurses, school counselors, and others were spending money from their own pocketbooks to buy underwear for kids who may have had an accident at school to get them back in the classroom. Undies for Everyone is approaching it's in its 10th year and is continuing to grow. So that small organization that I met that was founded by Rabbi Amy Weiss here in Houston now serves children in more than 20 cities around the United States. So I'm privileged to be involved with Undies for Everyone from a board standpoint. I am currently serving as the vice chairman of the board this year and will continue to hopefully provide leadership in the coming couple of years. And it's an organization that's very important to me because it overlooks a basic need that children have. And it's not something in the used clothing life cycle you want to hear about. It's everyone wants new underwear. So that's what we're doing to meet the needs of children.
Wow, that's great, and we'll make sure to include a link in the show notes for people to go check out. But you're right; it's something that's not thought about. Plus, it's the thing that you get at Christmas, right? Socks and underwear. That is the most boring gift, but it's probably the one you need the most. And so,
it is.
So that's great. So I really have a lot of respect for that. So thank you for doing that. Okay, so let's launch into you. We would love to learn more about you. So in your own words, maybe you could introduce yourself, tell us about your background and so on.
Chris, I'm honored to tell you a little bit about myself. I have a native Texan, lived most all of my life in Texas. My husband and I made Houston home in 2001. I'm a graduate of Texas A&M University. My husband, on the other hand, earned his degrees at the University of Texas. So we do have a little bit of friendly rivalry at our home between the UT Longhorns and the Texas A&M Aggies. I think they're going to start playing football again in the next few years, and so that will be a important game every year for bragging rights in our household. But I have, after earning my degree from Texas A&M, I had a more than 22-year career with the professional services firm PwC. I loved my work at PwC, got to work with amazing clients in the energy, utilities, and mining sector, and had a great group of partners I work with. I left that job in 2020, in early 2020, and decided to take a little bit of a break. Little did I know a pandemic had occurred and changed the course of all of our lives. But stepping back a little bit further, it was in 2001. My husband and I had just moved to Houston, and I ended up being diagnosed with a primary immune deficiency called Common Variable Immune Deficiency. And that's what gets me here today talking to you. So it was with that diagnosis, something I had never heard of. I had never heard of a primary immune deficiency. And let's just say getting that diagnosis was quite a mouthful. Common Variable Immune Deficiency. The abbreviation CVID is commonly used, but there's nothing common about it. Variable is the key word. It is highly variable. I say if you meet one patient with an immune deficiency or with even CVID, you've only met one patient, and that's their story, because there's so much variability in living with an immune deficiency. And when you live with an immune deficiency, that means some part of your immune system is not working, or in my case, there are parts missing and other parts that are really working against me as well. So it's quite a complicated diagnosis, but over the past 20 plus years, I've fared quite well due to the treatment that I get. And that treatment is with a plasma-derived product.
Yeah, so tell us a little bit more what it means to be a patient who relies on plasma-derived therapies.
So when I was diagnosed in 2001, I was thankful that I had a physician that gave me a lot of confidence in my diagnosis. He was very much said, focus on the positive. Unlike many patients who are diagnosed and go on a diagnostic odyssey ranging anywhere from a couple of years to nearly a decade, I was diagnosed very promptly. Again, I'm a proud Texan, a proud Houstonian, and thankful to have access to the resources of the Texas Medical Center here in Houston. And so my prompt diagnosis was very much a positive. Another positive is that the physician said right away, we have a treatment option that we know works very well for patients like you. So I began that treatment of what is called IVIG. Basically, it's infused immunoglobulin, and that is a plasma-derived product. So the immunoglobulin contains the antibodies that my B cells don't make. So prior to this therapy and beginning this therapy, many of the things that I was getting sick all of the time, sinus infections and other infections, lung infections that wouldn't clear easily, would take a little bit longer than the average person, and then they would bounce back. So I was pretty much playing a whack-a-mole with some infections. And so with immunoglobulin products, again, they're derived from donor plasma, this product gives me a fighting chance in the world and makes my immune system act like a bit more of a normal, healthy person's immune system.
Very interesting. So you talked about your prompt diagnosis, but you were in your 20s, right?
I was in my 20s. I was a couple years into my career. I had just gotten married. So life was really good. And it was, and it still is.
Hmm. So, and not everybody has a prompt diagnosis, but were there, and you've lived with this your whole life, I'm assuming, not knowing that much about it. But were there any signs when you were younger, as a kid, like that made you think something was up?
It's possible that as a child I could have been diagnosed. And I think there were a couple of points in my early childhood that doctors were onto something, but the again, I was a child of the 80s, and medical technology, we've seen lots of advancements. I was getting infections like cat scratch fever. I had chicken pox for a long time. If anyone had pink eye, especially in high school and in the dorms, I would always have pink eye. So these little infections, but for whatever reason, I was a pretty resilient child and just kind of kept bouncing back. And it wasn't until a physician really started delving into some blood work that realized, well, there may be something to this, and having access to then specialists here in Houston that really know the field of immunology is what ensured I received the proper diagnosis.
Okay. And so not everybody has the same experience, right? Maybe you could talk a little bit more about, from the patient perspective, what it's like to go down the path to getting diagnosed, to then receiving the correct treatment.
Sure, Chris. So, one of the most important things is to emphasize to everyone is a diagnosis like mine of a primary immune deficiency, specifically common variable immune deficiency, means I will have this, means it's a chronic disease. Chronic means it will never go away, and it will be with me for the rest of my life, whether I like it or not. And so a chronic diagnosis is something that a physician just does not want to make loosely or without great care. Also, because there's a lot of testing involved to get the proper diagnosis to ensure that payers, that's health insurance companies, will pay for the right treatment. So, for some of our patients, it they do go through a diagnostic odyssey. Maybe they have experiences where physicians have brushed them off and said, oh, you're just the sickly one, or, just another antibiotic, let's try this, or, you're just a complainer, or it's all in your head. That's one of the worst things that a patient can be told. But it takes a lot of personal advocacy as well as finding the right doctors to really get to a diagnosis. And I will say the Immune Deficiency Foundation and other organizations are working very hard to train even primary care physicians, such as family practitioners, internal medicine doctors, and pediatricians, how to better identify patients who need to go through the testing to consider if they have and live with a primary immune deficiency. Because the time to diagnosis being in the average neighborhood of 7 or more years is a really long time. But if a physician believes their patient is living with a potential primary immune deficiency diagnosis, there are some rather non-invasive tests, meaning blood work, that can be done to evaluate the patient and be able to confirm a diagnosis and get everything in order so that a proper treatment plan can begin.
So is it a simple blood test that's like a yes or no? This person has it, or is it more complex than that?
It's a little bit more complex than that. Certainly, there are blood tests, and then there is a process of going through a vaccine challenge. So, patients who live particularly with my immune deficiency do not respond well to vaccines. So, what you can do is vaccinate the individual with certain vaccines and then evaluate their body's response to those vaccines with some follow up blood work, and that will help confirm the diagnosis. So, It doesn't happen overnight. I wouldn't say it's a simple blood test, and I would say it does take some time. And certainly medical history also plays a part. Understanding the patient and understanding how they have responded to different types of antibiotics, what their medical history has been. And Chris, I would encourage you to talk to immunologists in this field because they are excellent at explaining the diagnostic process.
Yeah, it's and our healthcare system as it stands currently is probably not designed to have that long-lasting relationship, right? Where the physician understands this person, as they grow up, from a child to adolescence to adulthood.
And that certainly was me in my pediatric care. I had good physicians, but we moved with my dad's job every few years. So I didn't have continuous pediatric care from one pediatrician. And I will say the good or bad about electronic medical records, I mean, it wasn't like you passed paper records from doctor to doctor in the 80s. That just wasn't done. So you can say, there's some pros and cons to electronic medical records, but I think there are some benefits in having that documentation being a little bit more readily accessible today for to support the diagnostic process than in the past.
Sure. Okay, so there's the blood test and the vaccine challenge side of things. What about, is there a genetic test that can be done at birth? May not be cost effective at this point, but is there something?
So, primary immune deficiencies is a large category of about 450 diagnoses. So it's a big pool or category of diseases. And that does include one particular diagnosis, severe combined immune deficiency, SCID, that can be diagnosed and is diagnosed in the United States with the newborn screening panel. So every child born in the 50 states in the United States is tested at birth for severe combined immune deficiency. And some people may remember discussions of SCID or severe combined immune deficiency in I think it was a late 80s or early 90s movie about David Vedder, the boy in the bubble. And he was actually treated at Texas Children's Hospital, where my clinical immunologist is located. So his diagnosis is the most severe diagnosis of the continuum of the more than 400 primary immune deficiency diseases. So that can be diagnosed at birth and is in all 50 states, thankfully to the advocacy work of so many in getting that on the newborn screening panel in all 50 states. Now, one of the great advancements I've seen in the last 20 years is the lower cost genetic testing. Now, genetic testing is not talking about Ancestry.com and 23andMe. That's all cool for entertainment value. But true medical diagnostic testing with a genetic counselor involved and going through that genetic evaluation. So yes, that is becoming more readily available, but it does not necessarily change the treatment a patient is given. I happen to know, because of genetic testing, where there is in my genes, where there is what mutation there is in my gene that gives rise to a more specific even diagnosis for me. Genetic testing is great, but it's also not something you can just go out and get anyone wanting the genetic testing. And it does need to come with the appropriate genetic counseling. And I am a very strong advocate of genetic counseling so that people understand what information is being disclosed to them and what answers they get, what answers they don't get from genetic testing.
Okay. Um, yeah, the diagnosis to me seems to be, I mean, just the extended length of it. And, I'm assuming that due to the severity of some of these infections, that it could lead to death if you're not diagnosed and not treated properly.
Oh, certainly. I mean, the risk of having infections that then are so severe and include things like sepsis that can take over. It's a bloodborne infection. They can take over one's body, or even such severe pneumonias that it causes terrible lung damage. And you talk to some patients in our patient community, and you hear stories that maybe a family member died at an early age, maybe a parent or grandparent, and they may not have had the proper diagnosis, but when they look back, they're like, it's possible my father or my grandfather or some family member died at an early age of something that could have been diagnosed as an immune deficiency. And so, what we need is earlier diagnosis, whether it be, in children or adults, so that they can get the proper treatment to live the best life possible and the healthiest life possible, to be contributing members to society, to be active and engaged family members, and doing all the things that are possible and are what they want to do. I think one of my biggest inspirations is meeting a lot of the children or young adults who were diagnosed early, and they tell stories that infusions are just have been a part of their life since they were, 4, 5, 6, 10 years old, and it's just a part of who they are. And they've gone on to college and done great things, and it's just a part of life. And that's the same for me as, beginning as a young adult. I was diagnosed, and it hasn't stopped me from doing anything I've wanted to do. It's changed some things in some respect, and I've had to manage my life with infusions, but the early diagnosis is key. And what organizations like the Immune Deficiency Foundation are doing to try to identify patients earlier to get access to the treatment.
Okay, that's a great transition because you touched on it. So maybe you could tell us how infusion impacts your life, or how the treatment in general impacts your life.
Sure. So let me go back to when I was first diagnosed. The only option of infusing these antibodies from immunoglobulin were to go into an infusion center that was like in a building adjacent to a hospital. So I would go once every 4 weeks, and then we discovered my body needed the product more often. And so we needed to increase it to every 3 weeks. And I would take one day every 3 weeks out of the month, every 3 weeks, and go into the infusion center. And so that was pretty much a day off of work, or a day that I took and just set up my office from the infusion center and had an IV in my arm while the product dripped into my arm. And while the actual time did not take, it was probably about a 4-hour time period, just getting everything set up and doing all the paperwork in the office, and getting vital signs, and then working with the pharmacy to get the product actually mixed up or hung in an IV bag. All those little things take time. So it was pretty much a day out of my life. And then it was a little bit more than 10 years ago that a alternative delivery method was made available. So again, hooray for technology and advancements in science, because subcutaneous infusions were made available to patients. And that changed everything for me when that product was made available to me. So instead of going to an infusion center once every 3 weeks and having to take off work and paying for parking and not being possibly the highest priority patients, and kind of competing with the nurses for time, and just waiting my turn, which is what you have to patiently do, is I can infuse the virtually the same product on my own at home by using a needle set that I infuse in the subcutaneous fat layer of my skin. And so I just set this all up at home. I now do it once a week, and it works very well for me. The body cannot take as much of the product and metabolize it and go through all the physiological processes. So you can't give as much subcutaneously as you can via an IV for patients like me. So I infuse every week without fail. I have never missed an infusion. I take my infusion wherever I am, whatever I am doing. It's just a part of my life. And so doing subcutaneous infusions also improved my quality of life. So it gives me a very steady state of immunoglobulins, and that keeps infections from having their opportune time to enter my body when my antibodies are low. So keeping a strong level that is done every week is an advantage to me medically, as well as somewhat emotionally and mentally. Yes, there is a commitment of time. I have to figure out how to carve out about 2 hours, and I do it every Friday without fail. But I just make it work for me. Sometimes I'm at my desk working. Sometimes I take my infusion on a walk. Sometimes I've infused in quite a wide variety of places wherever I am when I need to do my weekly infusion.
Okay, so with the subcutaneous, it sounds like you're able to better incorporate that into your life. That's not available, or it's not the proper method of treatment for everybody, is it?
It does for persons living with a primary immune deficiency. It is a treatment option. And the great thing we have right now is that there are a number of different options and modalities. So some patients prefer going into an infusion center once a month, once every 3 weeks, because they don't want to deal with the delivery of all the supplies and organizing everything. And maybe they have children in their home and they just don't want to have, they want to get away. And getting away to an infusion center to do their treatment works best for them. So there are different modalities that work well for PI patients. And that's the great thing, is that those options exist today. When I was diagnosed, I didn't have those options.
Okay. So moving into your advocacy work, so tell me, like, how do you advocate for patients? Like, what types of things do you do?
Well, I'll say for the first, advocacy begins at home and with oneself. So first, there's the level of self-advocacy and going to bat for yourself when trying to ensure you're getting access to the best physicians, the right treatment for you. And that is the first component of advocacy. Then it is also working with other patients, working in the community, working with medical professionals, working with our elected leaders and others to understand what primary immune deficiency diseases are and how those diseases impact those patients and how we can improve the lives of those patients. So right now we're in a period of time when I personally am preparing to do work with the Texas state legislature on some issues that impact chronic and rare disease patients. And that means meeting with legislatures, telling the story of how patients are impacted and what changes need to be made. And so I have learned through advocacy days that have occurred with federal legislatures that telling a story and giving a person and a name and a constituent's experience helps them better understand the issue and how it impacts the individual citizen's life. And so there have been some great legislation that was passed and into law at the end of last year that ensures patients who are on certain federal government insurance programs have access to their immunoglobulin product, that they can receive it in their home rather than an infusion center, and have a home health nurse come and provide that product to them in a home-based setting rather than in a hospital or infusion clinic. And that's just really important. If you're a patient with an immune deficiency going into a hospital setting that may be filled with people, carrying all kinds of germs, or going to see the doctor because they think they have pneumonia, an immune deficient patient shouldn't be just wandering around with those people as well in the corridors of hospitals and clinics. So that IVIG at home option is really important for patients. So that was work. It took a number of years of advocacy by the Immune Deficiency Foundation and patient volunteers sharing what the impacts of that are to make that happen.
That it's fascinating, talking about the home infusion and how the pandemic has maybe contributed to the acceleration of some of these things. So telehealth, being one of them, because you're right. Like if you're immunocompromised, being in a hospital wandering around is probably the last place you should be. And so that's great. So the other side of this is ensuring that there's a sufficient level of engagement from people who are donating plasma, which is the source material for your treatments. So can you, and I know you do a lot of work visiting donor centers. Can you tell me what it's like when you visit a donor center?
So first, Chris, let me tell you that when I was diagnosed, I did not fully understand where this product that I was infused came from. I didn't have a good appreciation that it came from human donors. I just figured out it was probably manufactured in some lab and just came to me. Well, a little further investigation and getting a better understanding helped me realize there is a true human-to-human connection with plasma-derived therapies. So I have had the opportunity to visit a number of plasma donor centers, and it is the complex process and the involved process for safety reasons for both the donor and ultimately the recipient of these plasma-derived products is top of mind. And that is something that I was amazed with, that the technology and the tracking and how what is done to ensure that all donations are tracked and have followed through the system to ensure that the donor's health is of utmost importance, as well as to be able to deliver that unit of plasma to be manufactured. And so it was eye-opening, the complexity of the process involved at the donation center. And I was really overwhelmed by the number of people who, once I told my story at a donor center, that they better understood the whys of that. The plasma that they donate is really used by another person. I think many of the donors did not have appreciation. They thought that the signs on the walls that told a little bit about like how the plasma is used were maybe not real, or they were maybe a little bit skeptical of them. But when they meet a real human patient that relies on the product, it's life-changing for them. It's like, and it's a real human-to-human connection. So visiting the donor centers have been eye-opening for me, meeting the donors that come from all walks of life, that are finding, have the opportunity to donate plasma. And I hope that by visiting the donor centers, I give them a why and keep them coming back. to donate plasma, because we know we are trying to get more patients diagnosed with whatever diseases that are treated by these immunoglobulin therapies. So these using plasma-derived products, because that gives them a higher quality of life.
That's true. And you think about blood donation, right? Blood donation, always leads with the patient, and I mean, it's not always just a one-to-one, but it is like a one-to-one, right? One person to one person, in terms of transfusion. And plasma is a little bit different. The scale is different. It takes a lot of treatment or a lot of plasma, to go into a treatment. Can you tell us a little bit more about how much plasma is used to create a therapy for somebody like you?
So that was really overwhelming to me, of understanding that of the process of taking the unit of plasma and knowing that it takes more than 130 donors to provide me what I need for my infusions each year. So, and possibly more, that's an average that's put out by some trade organizations. And I would say that was, it's not a one-to-one relationship like a blood donor, a typical whole blood donor, that it requires so many more donors to meet the needs of a single patient. And there are even some diseases that are treated with plasma-derived therapies that require far more donors each year to provide them with the therapy that they need.
Yeah, and I think that's where we get lost sometimes, right? Is there's so much being collected that you tend to lose sight of the individual patient. And yes, these are used for people with rare and chronic conditions, but we call them rare in terms of 8 billion people on the planet, right? So there's still a lot of people out there with conditions that rely on plasma-derived therapies. Not only in instances like yours, there's also a trauma application to it, right? There's other products that are created from plasma donation that go to, such as albumin, that go to hospitals, for trauma and burns, and for victims. So plasma has just a tremendous amount of uses in the healthcare setting, and I think.
And so Chris, to that point, when you talk to donors, I encourage them and tell them, you want this product to be available for you or your family member or your friend or your neighbor should they need it. And the reality is, should you be involved in a major car accident or in a burn or other type of trauma, these products are used in every emergency room in the United States. It's not just for those rare diseases, but also if you have a family member or friend or colleague that is living with a rare disease, you want them to have them available. So that's why I always have a message to donors is thank you for being a donor. Encourage your friends to donate as well and advocate for more plasma donors, because if you need the product, you want it there for you. And so being a donor helps ensure that plasma-derived therapy that is used in a wide variety of applications is there for you when you need it.
Yeah, and it's something that it hits home with me too. After being in the industry for 20 years, I was diagnosed with a condition with a clotting condition that I don't rely on plasma to the same extent that you do, but I do rely on there being availability of it there in the event something happens to me. And so it does hit home. It hits a lot of different people, and it really is truly this much needed thing, much like blood is. It's the same thing, but I think we lose sight of it a lot of times, maybe because it's, I don't know, the for-profit industry, or it's, I don't know what the reason is. Maybe it's the scale of it. But the staff, forget that as well. And I think that's where patient visits to donor centers are not always just about donors. Like, that's a big part of it. It's also about the staff. I want to thank you personally, because you came out and spoke to our team recently and helped educate them, because we have a lot of people who have been in the industry for a long time, have not always heard the patient story one-on-one, but we also have a lot of new people coming into the industry all the time. So I think it is important to educate and continue to educate. So thank you for the advocacy work that you're doing there.
And so when I go out to donor centers, it's also talking to the staff because I recognize in many of the donor centers, there are a number of jobs that are very routine and they are done over and over and over for every unit of plasma collected, for every donor. And it may seem like a very routine task, but that helps ensure the safety of the product, the safety for both the donor as well as the patient. And I try to give purpose to the work they do from a patient perspective of saying, all of these things that you're doing every day and these checklists and these quality control monitoring that are done, some of them, hourly, daily, weekly, monthly, may seem like just another checklist, but they're there for a purpose and they are to ensure that the product is as safe as possible for both, and the donation process is safe for the donor, as well as the product that comes from that donation, that unit of plasma, is safe for the recipient. And so, yes, it seems like just another checklist, but you're doing that checklist to ensure that we have the best available product available to recipients.
Yeah. And so thank you for that. And I have one final question for you. So like the plasma derived therapies as we use them now are for the treatment of these conditions. Do you foresee a cure in your lifetime being available?
So for my specific diagnosis, I don't see a cure in my lifetime. And if anything, I want people to be more diagnosed and get the access to the treatment than finding a cure. Finding a cure would be great, but there are still a lot of limitations to what I think would be a likely cure, and that is in the world of genetic gene therapies. And I think we are still very much a long way off from gene therapies and gene editing technology that could possibly provide a cure. For some immune deficiencies, a stem cell transplant, bone marrow transplant are an option and a cure for some patients with very severe immune deficiencies. And that is what is done with patients who live with or who are diagnosed at birth with severe combined immune deficiency. And that is starting to be done with several other diagnoses, but that's still a developing treatment for persons with my immune deficiency. It is too high risk for persons with my immune deficiency. It's just not we just want a treatment and availability of that treatment more than anything, and that diagnosis. So while a cure sounds great, and there are sometimes, Chris, let me just tell you, going back to having an authentic patient voice, it was just the last week where I had no want in my body to stick 4 needles in my abdomen and infuse. And I recognize there are some weeks, possibly it's 2 out of 52 a year, then that I can just have one of those I don't want to infuse. But the reality is I know I have to, and I got over it. But being authentic about it and sharing a real experience, last week was just one of those weeks that I had a case of the I don't want us. And as grateful as I am that the infusion therapy is there, I'm also human. And we can all have days that we just have those I don't want to days. And for me and my infusion last week, that was one of those days. So, in the spirit of authenticity, yes, I am grateful for the product, but every now and then I do have that moment of, I wish there was another option. I could do this in pill format or some other way, but that's not there for me.
Yeah. Thank you so much for sharing and thank you for coming on and sharing your story and talking to us today. We really appreciate it.
Well, Chris, thanks for all you do in the plasma-derived therapies industry and ensuring that patients like me and so many other patients living with different diagnoses that require plasma-derived therapies get access to their products because of the complex supply chain that exists in the plasma donation world.
Thank you so much for listening, and remember, plasma saves lives. If you enjoyed today's episode, please share with your friends and fellow plasma donors. I'd love to connect with you. If you are interested in discussing today's episode further, please send a message to info@proesisbio.com. That's info@proesisbio.com. And don't forget to follow us on social media for up-to-date information. Find us by searching @ProesisBio. Talk soon.